On the phone right now is Melody Butler. She's the founder of Nurses Who Vaccinate, and she is a registered nurse. Hi, Melody, and thanks for joining me today.
Hi, how are you? Thank you for the invite.
Oh, perfect. I'm so glad you could come on. Well, let me just start out. Go ahead and introduce your organization, what you guys do, and what prompted you to start this.
So I am a pediatric nurse from Long Island, New York, a little ways away from Florida, and I work nights, and I have 4 children. When I was pregnant with my third son, when New York was experiencing the H1N1 flu outbreak, New York State was about to implement a mandatory flu shot rule among the healthcare workers. And being pregnant, I was very concerned, so I looked up some information. Unfortunately, I fell victim to misinformation, and I believed at the time that the flu shot would have been dangerous for me as a pregnant mother to take, and I was very indignant, and I was about to refuse the flu shot. Fortunately, I had a fantastic clinical nurse educator who took the time to sit down with me, go over the evidence I presented to her, and she was able to explain why the information I was basing my decision on was incorrect, outdated, and inaccurate. She then was able to pull up studies and medical research to show me that actually, as a pregnant mother, I was the most at risk for complications from the flu, that the H1N1 flu shot, while it was a new vaccine, had been studied for many, many years before being available to the public, and that I really was on the high list of priority to get it. And thanks for her. And this is a conversation that took place over a course of a week or so. I was fortunate to be on the first of the list of the high priority in my hospital to get the flu shot. Thankfully, because a month or two later, there ended up being a shortage. I don't know if you recall that with during 2009.
Yes.
And they ended up being very hard to get. So fortunately, I had gotten the flu shot very early on in the flu season, but a fellow friend of mine who was pregnant, pregnancy buddies, she was not able to get the flu shot early on in her pregnancy, and she, as a result, pregnant with twins, suffered a miscarriage with one of them when she contracted the H1N1 flu. And it was very terrifying for me to see this parallel. Here we were, very healthy individuals, me and her, very similar health history, and she caught the flu and she lost one of her children. And had I still stuck to my guns with this misinformation that had presented to me, I could have very well have been in her situation. I'm a pediatric nurse. I have kids sneezing and coughing on me my entire shift. Mm-hmm. So that was my first experience as, oh my goodness, I fell victim to this. Here I am, a pediatric nurse with, a bachelor's degree. I know how to read research papers. How did I, how was I taken? How was I scammed? So that was the first little bit of that planted the seed. And then later on, a couple months later, I came across a group on the internet called Nurses Who Don't Vaccinate. And I had just came home from a late night shift, and I was kind of cranky, and I was like, oh no, we're not going to have this. I can't have nurses speaking on behalf of the profession, giving out bad information, and telling people not to vaccinate when majority of the medical researchers in the world and professionals are telling people the exact opposite. I mean, you have, the AAP and the American Nursing Association highly advocating for vaccines among healthcare workers and the public. I didn't feel comfortable with these nurses speaking on my behalf, telling people not to. So I started my Nurses Vaccinate page as a Facebook page originally, and from there it just blew up. Nurses just were gravitating towards it because they wanted a community where they can feel safe, and it's very pro-science, very evidence-based, everything we share on there. And so went from a Facebook page to a web page, and now we have a blog. We're on Twitter, Pinterest, Instagram, anywhere that there is a social media platform. Nurses need to be present to counter the misinformation. And that is our mission, that's our game, and we like to make sure that we're using our educational background and our reputation. Nurses are seen as the most trusted profession, one of the highly trusted professions, and if people are going to listen to us, we need to take advantage of that and really make sure we're using this to our best abilities to educate them on the importance of vaccinating and how it's so important.
Okay, well, let me piggyback on that then. Sure. And I know you experience this probably on a daily basis. Mm-hmm. Here I come into your doctor's office and bring in my child, and I've looked at the websites and the autism websites and this and that, and I've heard all the horror stories about possible thimerosal in the vaccines and all kinds of stuff like that. What do you, as a pediatric nurse, tell me as the parent to steer me in what I believe is the right direction?
Okay, so when I see patients, they're being admitted into the hospital. So at this point, you're going to be, you've already been seen by the ER, you've gone through the history. I kind of have a little bit of a heads up whether or not you're up to date on your vaccine. So I can kind of prep as opposed to where you're coming from. So I have a little bit of a leg up on that. And then when you come to my floor, usually your child's being admitted for something unrelated, hopefully, unrelated to being unvaccinated. Maybe it's like, an ear infection that won't go away, pneumonia, maybe a bad GI bug. And then I'll have an opportunity, because you're kind of stuck with me, right, as my patient, to kind of approach the topic very digitally. And what we have is there is an excellent framework of conversation that I try to abide by when I'm approaching this topic. It's called the CASE method. And basically it kind of frames the conversation when you're going to be talking to a patient. And it's very useful, and it's been used before. And there's 4 steps, CASE. And the first one is going to collaborate. And when you're talking to the patient, you're going to talk to them about why you're going to kind of get on their level, and you're going to explain to them when they tell you their concern. If you want to give me an example, what would be the example as a parent that you would have about vaccines? Do you have an example you just want to throw out at me? Or?
Oh, sure. Yeah, I could just say, well, I've been on these websites. They've, a lot of these people still believe that the Wakefield, still believe in the Wakefield studies. There's even been surveys saying that, the Wakefield studies existed, but, most of these people don't even know it was debunked. So, yeah, I'm reading these studies. I'm reading all these different websites. The CDC just said autism is now 1 in 68. Should my kid be getting the MMR?
Okay, so then what I would say, and this is true, because at the time, when I first heard about all these vaccines and the correlations that were coming out, I myself, as a parent, I was worried. So what I did as a nurse, I had access to specialists, and I spoke to them, and I was like, what do you make of all this information? And when I spoke to the infectious disease doctors and the immunologists, they were able to reassure me as a parent and as a nurse that there are plenty of studies out there that have showed that there is no correlation between vaccines and autism. There are actually 100 studies, and if you, as a parent, were interested in seeing them, I could gladly pull them up for you and show them to you. I can also explain to this in further detail if you're interested. What I like to continue this conversation past the visit. So I give them an opportunity to contact us because there's always going to be questions, and having questions is so important for as a parent, because it means you're involved in your child's health care. And so what we want to make sure we're encouraging these patients and their parents to really ask questions. And because then that's our mission. When we're educating them, we're making them strong enough to educate other parents when they come to the playground. So the first step is collaborate. And we're going to acknowledge the parent's concern and find some point we can agree on. So I'm going to agree with the parent. Yes, I heard about the studies, the 1 in 68. They were alarming to me as well. And then what I did, this is the A part, I went and I asked the professionals. And I asked them for their valid opinion and whether or not they vaccinate their children, if they are using the MMR. And what did they say? They told me, yes, that they are vaccinating their children on time, every time with the MMR, because they are relying on the scientific studies. And then that brings me into S, with the science. I can go into further detail about what the science says. And, of course, throughout this whole time, I'm involving the parent in the conversation and taking on questions. And I would say what the science says, that, we have over 100 studies, and that the studies show that there's no correlation. And that when Japan, for example, was very alarmed by this, they cut out the MMR, and what ended up happening, not only did they have increases in measles rates in the 70s, and when they got rid of the MMR, they also had an increase in autism. So clearly, and this is a study that involved over 8,000 children, so clearly there's no connection. And then the last part of the CASE method would be explain, advise, E. I would give my advice to the patient. I would, based on the science, I would explain to the patient and the parent. So I do, as a pediatric nurse and a mother of 4, I recommend you get the MMR. I would, whenever the doctor or the Department of Health advises for the timely scheduling, I would say get this as soon as possible, because you know why? Because we have measles outbreaks. For example, in New York City, we have 26 cases of measles. Right. You're kind of safe in Florida for now, hopefully. You guys have your nice community immunity keeping it up. But I would advise them, based on these outbreaks, it is even more imperative that you vaccinate your children and protect them. And that would be, so that's the case. Collaborate, C, about me, A, science is S, and explain for E.
Perfect. Let me switch gears a little bit. Melody, what's your thoughts on mandatory childhood vaccinations?
So that's going to really apply more to the schools and the school districts. And I know each state has their own concerns. In New York State, and I'm just going to be speaking mostly about New York, because that's what I'm most familiar with, we only allow medical and religion exemptions. And they're very strict about that. And I feel very confident and relieved about that, because that really keeps the community immunity levels high. And especially with New York being so international, we're very fortunate to have such a diverse communities here. I live on Long Island, and I live next door to a Polish community where I just got my babka and kibasi for my Easter morning breakfast tomorrow. And I'm fortunate to live very close to Hispanic communities where I can go, and there's always a lot of traveling going on. And because these children are in the schools, I feel very confident as a mother that they are maintaining this high level of protection. So for New York to have just the two exemptions, I agree with that, and I'm very confident with that. You do have access to, if you obviously if you have a medical reason not to vaccinate, then it's even more important for everyone around you to vaccinate to protect the child.
Okay. Well,
in Florida, what is the environment there? What is allowed?
It's pretty strict. It's much like New York. So we're not having any real issues now. And we have Miami here. We have Tampa. So we do have a lot of airport traffic and hubs like that where this kind of stuff can, there's outbreaks in the Philippines now, in Vietnam. And,
yes, I just saw over 100 people have died from that.
Yes.
And they're pretty up to date with their medical equipment. I mean, it's not like we're talking about, some parts of it are, need help. But majority of, they live in major cities, and that's where the outbreaks are occurring.
Yeah.
They're still the hospitals are being bombarded. I was reading the latest article.
Right.
So
it's
very, very scary.
All right, I got about 2 minutes till I come up against the break.
Okay.
One thing I want you to, if you can address Jenny McCarthy's recent op-ed, real kind of quickly.
Okay. So as a parent, I am familiar with why she was concerned initially. I do have to commend her on trying to correct her past statements. I really am. I'm a very optimistic person. I'm very hopeful that perhaps she's turning a new leaf, and I hope that with her new change and her desire to distance herself from the anti-vaccine title, that perhaps she's open to education. I wrote a letter to her, an open letter publicly from Nurses to Vaccinate, and basically, parent education on vaccines is an ongoing conversation. She clearly still has misconceptions, and she clearly still needs a one-on-one conversation with a qualified healthcare professional. I feel bad for her because anytime she has a question, it's going to be right in the public. And we can all misspeak. And goodness, if there was a camera always quoting me and following me, I'm sure I'd be saying, incorrect statements at times. But because she's in such a spotlight, she really has to pay very close attention to what she's saying. And in the past, she has really said a lot of misinformed statements, and that really has had an impact. I really do hope now, with her trying to distance herself, that she is able to have a positive impact at this point. And maybe if she just encourages people just to talk to their pediatricians as opposed to advocating for whatever is on her agenda, that would be the best bet for her. Like I said, I'm very optimistic, and I'm really hoping that with enough support, she could be pushed into a more positive mind frame about vaccines. If people, if she takes time to really read the scientific evidence as opposed to the misinformation out there.
Very well said. And last, Melody, I'll give you 30 seconds. If somebody wants to check out Nurses Who Vaccinate, if they want to become a member, what do they need to do?
So you just go to www.nurseswhovaccinate.org. It's a free membership. We are taking not just nurses, but healthcare workers as well, vaccine advocates. You join up, you'll be on the mailing list, and then we can invite you to any action alerts, any events, any activities, and it's really great because we're really trying to create a good foundation and organization for people to really come together. I collaborate with Voices for Vaccines for domestic U.S. issues. I collaborate with Shot at Life, which is for global issues, protecting children overseas and giving them vaccine access. So there's so much opportunity for everyone who has their own interests and has their specialties and their gifts. So I really invite everyone to come to the main website, check it out, follow us on Facebook. That's the most updated, constantly being everything up there is updated and always sharing new news and what's going on. So those are the two important things. And from there, you can connect to the Twitter, Pinterest, Instagram. I don't know, the blog, whatever else we have.
All kinds of social media. Yep.
Yeah, basically. Yeah, so it's very exciting, and I really invite everyone who's listening to like us on Facebook and check out the webpage and sign up to be a member.
Yeah, we definitely appreciate the good work you're doing.
Thank you.
I have so many more questions. The next time I'd like to have you on again, and maybe for a longer period of time.
Gladly, yeah, and hopefully I will escape my children who are sending me notes under the door.
Okay, all right. Well, I've been talking to Melody Butler. She's the founder of Nurses Who Vaccinate. Thank you, Melody, for calling me up on this Saturday. I appreciate it.
Yes, and you have a very lovely weekend. Hopefully the weather down there is just as nice as it is in New York today.
All right, thanks a lot.
All right, bye now.
Bye. All right, well, let's go ahead and go